So in today's class, the spotter is of the chapter GIT or section GIT and blood. There are many chapters in that, GIT and blood, right? And both are important chapters. There are amples of drugs in both the chapters. And you may be asked, you may be given any shot, any type, any formulation, any dosage form of a particular drug. Where it can be a single drug or a combination drug, fixed dose combination. And then you are required to identify and answer the respective questions which are kept in front of that particular spotter. So there is nothing very specific to teach in this spotter. If you have the thorough knowledge about the drugs, its mechanism, its adverse effect, the uses, the contraindications, then you would be able to write it. The peculiar thing in a spotter is how to concise the particular answer. Questions like mechanism of action is being asked in spotter also and in theory portion also. When you are writing the theory examination, you are supposed to write in details the mechanism of action. And you are supposed to draw the figure 2. But when you write the same mechanism of action for a spotter question, then you need to concise it. You need to shorten it. And you need to write only those words, those sentences which are very important in order to explain the mechanism of action. You hardly get a minute to write answer for the questions of spotters. Usually there are 2 questions. This is very difficult to write answer of 2 questions of one spot in 1 minute. And that too in details. So try to specifically answer the question and to the point. You hardly will get half or 1 marks for the right answer. So here what is important is that you need to write the specific and to the point answer. If the point is not good enough, the point is not important enough, then it will be considered as wrong. So keep that in your mind and you need to write in the respective way. See, in GIT we have peptic ulcer diseases, we have laxative and purgative, we have emetic and antiemetics. Then blood we have coagulant, anticoagulant, then hematinics chapters we have. So these are the important chapters. I will not specifically go through that what type of question would be kept and what type of drugs would be kept and what type of questions would be kept. In between, I will show you some PowerPoint, some important topics, important things, and then in between only I will tell what type of spot can be kept related to that and what type of question can be asked. Here, see emetics. You should first know the definition. What is emetics? Emetics is opposite of antiemetic. Emetic is the drugs or the things, the compound or the substance which produces emesis. Emesis means vomiting. Okay. So there is like many pathways through which this vomiting or emesis occur. That is the pathophysiology part. And there are paths which are obstructed or inhibited by many drugs which act as antiemetics. And there are drugs which stimulate those pathway and causes emesis. If you are clear with that pathway, you would be able to write the mechanism in short, very short. So emesis are the emesis is the condition in which there is vomiting or emetic. Emesis. Now, drugs which act on chemoreceptor trigger zone, that is apomorphine. Apomorphine. Morphine substituent, apomorphine. It's a dopaminergic agonist. Intramuscular subcutaneously can be given 6 milligram. Emesis will be caused in just 5 minutes. It is also CNS and respiratory depressant. If you have idea about morphine, you will know that why this effect is there and causes emesis. The second is which acts reflexively on chemoreceptor trigger zone, not directly acting on the chemoreceptor trigger zone, and that is ipecacuanha. Onset of action is 15 minutes. These type of drugs are given when you need to induce vomiting, which is generally during poisoning. Okay, all poisoning cases should not be tackled with emesis. So there are conditions in which the emesis is not advocated, the poisoning, and there are conditions in which the emesis should be done, and in those conditions, this emetics can be used. Where are these emetics contraindicated? When the poisoning is due to acid or alkali, when the poisoning is due to CNS stimulant like convulsions, when the when the poisoning is due to kerosene or petroleum poisoning, so there is a chance of aspiration pneumonia, there is a chance of convulsions in CNS system, there is a chance of perforation in esophageal injury. So acid and alkali will come in contact with the esophagus, and then it will cause injury to the esophageal cells. Unconscious patients should not be tried with this emetic because of the chance of aspiration or vomiters. Morphine or phenothiazine poisoning, this is not done because in this case, if emesis is done, it is quite ineffective. So you will be just losing out the time without any positive effect. So the question here may be asked if some antiemetic is being kept as a spot, and then it may be asked that tell me one emetic which can be used, and a condition in which tell me one condition or write one condition or down one condition in which the emetic should not be used. So this type of question can be asked in here. Antiemetics can be classified in 5 mainly, one is other, so 5 classes, and you should be particular, you should be thorough with this classification. We have anticholinergics like hyoscine, dicyclomine, H1 blocker, promethazine, diphenhydramine, neuroleptics, chlorpromazine, haloperidol, prokinetic, metoclopramide, domperidone, cholinergics, motilin-like agents, 5-HT3 antagonists, ondansetron, granisetron, and others like dexamethasone, benzodiazepines, and dronamine. These are different group of drugs, right? H1 blocker we have neuroleptics, we have the antiemetic drug for 5-HT and 3 antagonists, and these are used as antiemetic drug. You should be knowing the examples of each class, and as soon as the drug name comes, you should be able to recognize from which chapter, from which section, from which class the drug belongs to. So if like drug hyoscine is being kept, and then you are asked that tell me write down one uses of or one use of this drug. So like emesis or to cause emesis, to stop emesis can be there. For motion sickness, that can be one use. Okay, tell me write down one example of other group of drug which has antiemetic property. So you can write any of the drug from other group, metoclopramide from prokinetic group, or chlorpromazine from neuroleptic group. So this type of question may be asked. Or It can be asked like metoclopramide is kept. Give one example. Give one another example of the same group. That means apart from metoclopramide, you have to write another drug of the same group like domperidone. So likewise, question may be asked. This is the figure I was talking about to you. So we have higher cortical center, we have vomiting center here, labyrinth here, stomach and small intestine here, and chemoreceptor trigger zone here. So there is need to stimulate this vomiting center in order to have the emesis or vomiting. So it can be done via many way, through labyrinth, through stomach direct, or through via chemoreceptor trigger zone to vomiting center. And these steps are inhibited by the groups of drug. Benzodiazepine will inhibit this. Histamine, muscarine antagonist, the dopamine antagonist, and cannabinoids inhibit this particular stimulation of vomiting center by chemoreceptor trigger zone. 5-HT3 antagonist will inhibit the stimulation or induction of vomiting center through stomach or small intestine, or the chemoreceptor trigger zone. So if you remember, you can like a histamine antagonist. If the question is there, one drug is kept which is histamine antagonist, and ask the right terminal mechanism of action of this given spot in case of emesis, or how it stops emesis, or mechanism of action of antiemetic effect of the given drug. So what you need to write? Being the H1 antagonist, it inhibits the H1 or it blocks the H1 receptor and thus inhibit the induction of chemoreceptor through vomiting center through chemoreceptor trigger. So impulse transmission from this to this via this histamine receptors are blocked. That's it. So likewise, you should be having idea of the whole figure mechanism so that you can write in short. Anticholinergic like hyoscine, this is given in motion sickness. It has brief duration of action, and hyoscine patch comes, which is usually applied behind the pinna for longer duration of action. Usually, when it is not taken, it is not applied as transdermal patch, then it has brief duration. Otherwise, it has longer duration of action. So it blocks impulse from vestibule to vomiting center. Over. This is the mechanism. It blocks impulse through vomiting. From vestibule to vomiting center. Next is H1 blocker used in motion sickness, anticholinergic, antihistamine, selective action. It has, and cynarazine anti-vertigo drug is there, and this cynarazine act by inhibiting calcium influx from endolymph to vestibular sensory cell. But it should be taken 1 hour before if you are taking any drug for motion sickness. Once motion is started, it will not give its beneficial effect. Next, we have neuroleptic. We have studied this drug, this group in details in CNS. So it blocks the D2 receptor in chemoreceptor trigger zone. By inhibiting those receptors, it will inhibit the chemoreceptor trigger zone, and thus vomiting is antagonized. It can inhibit, antagonize apomorphine-induced vomiting. So this is important thing. When this group of drug is kept and then asked that to which is the drug which can antagonize the apomorphine-induced vomiting, the answer would be neuroleptics. Sorry. This is not effective for motion sickness. So you cannot, if asked that give examples of drugs used in motion sickness, so you cannot give this as an example of drug used in motion sickness. Next is prokinetic. It promotes gastrointestinal transit. Okay, peristalsis movement it increases so that the gastric content transfer from the stomach to the small intestine fast, and then there is nothing left in the stomach, and thus anti-emetic effect is generated. So it relaxes pylorus and duodenum, gastric emptying increases. Okay, so this is the mechanism. See, so short mechanism. Okay, so this you are supposed to write. Gastroesophageal reflux opposes by increasing lower esophageal sphincter. Next is D2 antagonism. This is the mechanism actually, prokinetic agent. We have D2 antagonism. It's a dopamine is inhibitory in nature, inhibitory transmitter in GIT. So it delays gastric emptying and relaxes LES. So you need to antagonize D2 mediated action, and that's so that there is inhibition of inhibitory transmitter of GIT. Okay, so that the gastric emptying increases. 5-HT4 agonism increase acetylcholine release. Gastric healing is increased because of increased release of acetylcholine. Like example, metoclopramide and cisapride. 5-HT3 agonism inhibitory on chemoreceptor triggers and nucleus tractus solitarius and block inhibitory magnetic interneuron. So in mechanism you can write it gives its effect by D2 antagonism, 5-HT4 agonism and 5-HT3 antagonism. That would be regarded as correct answer. 5-HT3 antagonist ondansetron by blocking the depolarizing action of 5-HT3. Where this particular group of drug is used, see, ondansetron, if you write in motion sickness, it won't be the correct answer. So for this, you have to be specific to cancer chemotherapy and radiotherapy induced post-operative nausea and vomiting. Post-operative nausea and vomiting. Then we have another chapter, laxative and purgative. The difference between laxative and purgative is like purgative is stronger laxative, or purgative is stronger in action, whereas laxative is milder in action. It produces well soft form stool, whereas this produces watery stool. Classification: luminally active agent. 1 to 3 days it takes, and non-specific stimulant 6 to 8 hours. Examples are given. You know the classification. So question may come like if particular group is kept castor oil, and then you are asked that write the group of drug in which this drug belongs to. So you have to write this is non-specific stimulant or irritant. Okay, likewise. Other classification like bulk forming agent, stool softener, lubricant, the stimulant purgative, bisacodyl, osmotic purgative. So these are the different groups, and these are the examples. So question can be given like give example of bulk forming drug or lubricant laxative. So you need to write this answer. If this is asked and you are asked to write the group, you have to write this too. Mechanism of action. Any laxative and purgative act by decreasing in the net absorption of water, increasing hydrophilic and osmotic action, and which retains water and electrolyte in the intestinal lumen, and volume is increased. Increase in propulsive activity, and there is less time for absorbing water and electrolyte. So in short, you have to write all the three. Next, we have how to increase the water content. can be by inhibiting the sodium or potassium ATPase, which causes impaired absorption, and stimulate adrenaline cycles in crypt cell, and increase prostaglandin synthesis. The stimulant purgative, they directly stimulate the enteric nervous system, activation of prostaglandin or CAMP or nitric oxide CGMP pathway, as well as it inhibits the sodium potassium ATPase, causing accumulation of water and electrolyte. Osmotic purgative, it acts by retaining water osmotically and distend the bowel. Also causes increased peristaltic movement. Uses of laxative, the functional constipation, spastic constipation, atonic constipation, bedridden patient to avoid straining at stool, preparation of bowel before surgery, colonoscopy, abdominal X-ray, after anthelmintic, and food and drug poisoning. See, so many uses are there of laxative. When we keep any drug from this group, usually the students write constipation. Right? See, other than that, these are the things. Right? You can have a look on those things also. Then we have opioid receptor antagonist, methylnaltrexone or albumipan, inhibit peripheral mu receptors. Uses of these drugs, cholera and Clostridium jejuni, like tetracycline cotrimoxazole quinolone, or Clostridium difficile metronidazole vancomycin, amoebiasis, giardiasis, metronidazole diloxanate furet. What are the non-specific antidiarrheal? Like absorbent. These are, we are talking about now antidiarrheal drugs. So bulk forming drug, psyllium, cholestyramine. Otherwise, these are given. Anti-motility and anti-secretory drug, opioids like loperamide. This is very important drug. Intestinal motility is given by mu receptor, secretion by delta receptor, and absorption by mu and delta receptor. There is poor CNS penetration. Where it can be used? It can be used in traveler's diarrhea, antimicrobials with trimethoprim sulfamethoxazole, that is cotrimoxazole or fluoroquinolone. Chronic diarrheal diseases. So in these cases, can be used. Clonidine also can be given where? In case of diabetes with chronic diarrhea, opioid withdrawal, hypotension, depression or fatigue, sulfasalazine or mesalazine. This drug many times you must have heard. This is 5-amino-salicylic acid, which has anti-inflammatory effect. Drugs for peptic ulcer disease. Acid peptic disorders like GERD, benign peptic ulcer, or NSAIDs induced ulcer, or Zollinger-Ellison syndrome. All these are the peptic ulcer or gastrointestinal disorder where many drugs can be used. The classification is as to antihistamines, cimetidine, ranitidine, famotidine, loxatidine, proton pump inhibitor, anticholinergic, PGNLR. This is very important group because 1 or 2 spotters are usually kept from this very chapter. So neutralization of gastric acid, systemic sodium bicarbonate citrate, non-systemic magnesium hydroxide trisilicate, ulcer protective sucralfate or CBS, the ulcer healing carbinoxolone sodium, and anti-H bilateral. This particular group is very important. This particular group is very important. This particular group is very important. So make a note of it. And the classification of this particular chapter is very, very important. The regulation of gastric acid secretion, we'll see through photo. Yeah, so this one. It's like this is the proton pump, and the proton pump inhibitor will act over here. There is H is here, and then Cl you get it from here. So there is formation of HCl. There is many stimulation or inhibition caused by many other factors, which is inhibited or stimulated by drugs. H2 receptor. It stimulates the CAMP pathway, causing stimulation of the proton pump, causing generation of more H plus ion and more of acid. So you need to block this. Okay, histamine acts on it. So H2 blocker is given. M3 receptor again causes stimulation and stimulation and then more SCL formation. So muscarine antagonist is given. Likewise, you need to remember the mucus forming drug like sucralfate and carbamazepine sodium. These helps by increasing the protective mechanism or is making the protective mechanism stronger by producing more of mucus. Uses duodenal ulcer, gastric ulcer, stress ulcer, and gastritis, Zollinger-Ellison syndrome, and tumor. It's a tumor secreting gastric. PPI mechanism I will tell. It reaches the parietal cell and convert to sulfonic acid and sulfonamide. Two molecules make a covalent disulfide bond with SH group of proton pump and irreversibly inactivated. So this is the mechanism you need to write. Uses same we have discussed anti-H. pylori drug. This is important because of H. pylori infestation. This happens and we have mainly two type of treatment, the triple therapy 14 days or quadruple therapy 14 days, where three drugs are given. Can be proton pump inhibitor plus clarithromycin plus metronidazole or amoxicillin, any one of it, twice a day. And here metronidazole, bismuth-salicylate, tetracycline 4 times a day. So you need to remember which group of drugs are given in H. pylori regimen and which specific drug of which group is given for how many days in H. pylori regimen. Then coming to this blood chapter, iron storage, there is nothing much. Iron preparation will be kept, and then which form of iron is present, which form of iron is mostly absorbed easily. Those type of drugs can be asked. Oral preparation, what are the examples of oral preparation? Sulfate, gluconate, fumarate. Then parenteral preparation, why is the parenteral, due to advantages of parenteral preparation over oral preparation or oral preparation over parenteral preparation, disadvantages. So likewise, questions may be asked which form, which dosage form is given in which condition. So likewise, question can be asked. Vitamin B12, what is the name, what is the active form, then erythropoietin, what it is, generally question doesn't come from this one, erythropoietin, at least for spotter one. So you can leave this. Again, the apolipidemic drug, you need to know the classification and the mechanism through which this act, endogenous pathway and endogenous pathway. To explain, HMG-CoA reductase. So examples, atorvastatin, lovastatin. So one drug and what is the use, where it is used, and what are the other examples of the same group, what are the other examples of the different group of drug. So likewise, question will be asked. I'm not keeping well from last 3 to 4 days. Though questions, what I mean to say is like a spotter, like any type of drug can be kept. Any drug can be kept. There is no important question or no important drug or unimportant drug. The thing is, you need to have the idea, basic idea about the particular chapter. If you have that, you would be able to produce you would be able to write the answer of specific questions in this model. So that's it. Thank you so much.